It's not, let me just go get a test and figure out what I am allergic to. It is, get a history and then let us understand what we should test you to. I always hear this from patients, I'm allergic to everything. That's really not useful. So really, you actually want to say, why are you testing me to this? Are these pollens that you're testing me to even relevant to my region?
This is Sick Health with Kevin Ban, MD. Our show helps you navigate our confusing healthcare system so you can take control of your own health. We have a great show for you today. I get the opportunity to learn a lot about all things allergy. I came in thinking I knew my stuff, and I was just learning throughout the entirety of this conversation. I sat down with Tania Elliot. She trained in internal medicine and later in allergy. She's currently faculty at New York University, and she's the spokesperson for the American College of Allergies, Asthma, and Immunology. This was a really great conversation. I hope you enjoy it. The best way to support the show is by liking one of the videos and subscribing. Tania, thank you so much for joining the show today. I have been looking forward to this conversation. In fact, this morning, I went out in my truck and it was just covered in pollen. I'm waiting for this pollen to go away, but we need some rain to help wash it away. And I'm looking forward to the conversation because it reminds me that so many people now, as we're coming into the summer, suffer from allergies. And we're going to go into allergies. We're going to go into indoor allergies, seasonal allergies, the whole thing. But before we do any of that, I want to talk about you. And I'd like to start with how you got into medicine. Like, what was that journey?
I can't in good conscience go on with this conversation without talking about the first myth you just brought up, which is that rainfall washes pollen away. In fact, rainfall can make pollen worse. In particular, a thunderstorm, which would aggravate the pollen, particularly grass pollen, make it airborne, and then our pollen counts are highest right after a thunderstorm. So you actually want to stay inside right after it rains if you suffer from allergies.
I love it. So that's where we're gonna definitely be doing some myth busting today. But I will tell you this: it cleans my truck off. It kills me. I have a black Ford F-150 hybrid, I should mention, and I walk outside and it's yellow. And I'm like, I need to clean that thing up. But that's great. We're going to dive deep and myth bust today. But before we do, you cannot evade the question. How did you decide to go into medicine?
Well, the biggest thing for me was doing detective work and really trying to figure out what was going on in a given situation. And I think that passion of trying to really dive deep to understand what was happening, whether it was in a science experiment or in an environment or in a situation or a relationship with someone, I always wanted to dig deep and really leverage my listening skills to learn more and get to the bottom of the problem. And I found that medicine was a way for me to do that every day and really help change people's lives, because 90% of the diagnosis we make, as you know, is based off of clinical history. So it was really my passion for active listening and hearing what people have to say and understanding some of the cultural factors, environmental factors, what was going on in their life. And then together, we could figure out what was going on and help get on the path to feeling better. And that it's as simple as that. I liked listening to people and I liked trying to figure out the details and help get to the bottom of things.
Yeah, it's interesting that I had the similar experience that, you really go deep, especially as a medical student, where remember you go in there and you would talk to patients for like 45 minutes, something we never do as attendings, but you could really find out all of the information. And then it was a matter of figuring out like, hey, what comes together? What's key here? What's less important? So that's a fascinating reason. And I love it. How did you land in allergy and how did you become an allergist?
Well, allergy often tends to be one of the last specialties that people come to. It, again, was so much about that detective work. And particularly, could there be something in somebody's environment that was triggering their symptoms? There's a great story I heard about a patient with asthma that showed up to the emergency room 370 times in a year, which meant that sometimes she went more than once a day. And it didn't matter what medication she was on. They knew she was compliant with her medications. She was still showing up in the emergency room, and she was written up as a case study as one of the most complicated asthmatic patients. And turned out the issue was that she had a lanolin wool rug in her bedroom. And the minute that rug was taken out of her bedroom, her symptoms went away. She didn't go back to the emergency room. Quite frankly, she didn't even need medications. And it was as simple as that. And I thought, this is the coolest field. If I could just see into somebody's home, if I could talk to them and try to figure out what they do for a living that could be contributing, it could be life-changing just like that. So that was it. I was sold on Allergy when I realized how much somebody's external environmental factors could be impacting their overall health.
I didn't get that experience until I was a resident. And, I'm an emergency medicine physician. And by the way, I've seen so many patients come into the emergency department because of asthma. And the truth is often they are not on the right medications. And I think that later, after we get through summer allergies and everything, you should come back and we should talk about, the treatment for some of these disorders that oftentimes are environmental. And I saw that when I would get into the home of people while I was doing my paramedic service. That's part of your emergency medicine training. And boy, is it eye-opening to understand the whole person. So I love that you made that point, and we'll come back to that. Let's just talk about allergies in general. Specifically, we'll start with intolerance versus allergy, because I see that oftentimes people mix this up. And it's helpful to really have a good sense for what's the difference between a true allergy versus an intolerance.
It's a great question. And actually on my YouTube channel, I go deeper in this. So if you're interested in learning more, you could go ahead and subscribe to my channel too. So an allergy is actually your body creating antibodies to something that's normally occurring in the environment. And when you are exposed to that thing that's normally occurring in the environment, you develop an allergic response. It triggers an immunologic reaction, and it can be from a very trace amount. When we talk about allergy versus intolerance, we're usually talking about foods. And so someone who has a food allergy can take a trace amount of something, even just from it coming into contact with the allergen, and you can develop life-threatening allergic reactions from it. So an intolerance tends to be dose dependent. It does not trigger an immunologic response. It tends to be either you're missing an enzyme that's needed to break down a certain food. So the best example is something like lactose intolerance. So you're missing the enzyme to break down lactose. And so you end up with a buildup of lactic acid that builds up in your gut, and then you have bloating and discomfort. So that would be considered an intolerance. Your body might be missing a certain enzyme or something that prevents you from breaking something down properly. And what we see with intolerances is it tends to be dose dependent. So the more you take in of something, the more likely you are to your body to reject it, so to speak. So a good way to think about an intolerance is it's just something that doesn't agree with you, versus an allergy where your immune system is saying, hey, this is something foreign, like a virus, like a bacteria, and my immune system now is going to fight for its life against it and release all of these inflammatory mediators to fight off this foreign body.
I'm going to dive deeper into the allergy part of it, which is you mentioned that your body, your immune system recognizes. So you've got antibodies that recognize proteins, and then you have this immune response. Do people need to see that thing that they might be allergic to so that their bodies can actually develop antibodies, and then later you see the allergic reaction? Or can it happen that they've never been exposed to that thing and immediately they have the allergic reaction?
That's an important question. You do need an initial exposure to something before you can develop an allergy to it. That said, there are things that can directly activate your allergy cells, so it could get confusing. So certain medications can do that, where the first time you're exposed to it, it causes what's called a direct mast cell degranulation. It gets a little complicated because the end effect is the same, right? Your allergy cells release these mediators, specifically something called histamine, that's responsible for itching, redness, swelling. But for a classic allergy, you need to be exposed to it once, and your body says, oh, okay, I think that's something a little foreign. All right, I'm going to remember that. Similar to the way vaccines work, you get exposed to something once, your body's like, I'm going to remember that. And then when you would get exposed again, the body's prepared and says, now I'm going to attack it. But you need that initial exposure for your body to develop antibodies. So again, very similar to how vaccines work, where you're exposed to something, you may have a local reaction. The body's like, hey, that didn't feel right. And then when you are exposed to the virus or bacteria, it's ready to go full on. So one other thing I'll share is that there are two types of immune system cells. There's Th1 cells that fight against viruses and bacteria. And then there's something called Th2 cells that fight against parasites. When you have an allergy, these allergenic proteins hijack that Th2 response. So it is a true immune response. It was meant to fight against parasites, but instead, because we don't really have many parasites in the developed world, that part of the immune system almost gets bored in people. So they're like, you know what, I'm going to just react to something that's normally occurring in the environment. And interestingly, in underdeveloped countries where there are parasitic infections and lots of parasitic infections, you don't see allergies because those Th2 cells are busy fighting against those parasites.
Yeah, you know what? I was thinking, just as you mentioned that, the Th2, I was thinking about it being sort of parasitic, oftentimes worms, frequently found in the gut, if I remember this. I mean, I'm going all the way back to medical school on this one.
Going way back.
In the gut. And you're right, like you degranulate the mast cells. You mentioned the histamine. That's one of the mediators, probably the most common one. But what happens is that you have this reaction, which in the gut creates sort of a slimy environment, which is good for getting rid of those parasites, those worms. But now they've largely become sort of a reaction, and people will get what we call allergic rhinitis, which is just a really fancy way of saying stuffy nose and itchy eyes. And it's fascinating, however, that people in the developing world don't experience that as much because they're using the Th2 system for what it was initially intended to do. I had an experience where about 10 years ago, having never had any allergies in my life, all of a sudden I developed them. And strangely, because I'd never had allergies, I didn't know what it was. I didn't know what was causing it. And then a friend who's an allergist said, look, I think these are just allergies. And I treated it and I got better. And then strangely, it went away and it didn't come back. So my question here is, my sense is that you can develop allergies, you can grow out of allergies. So take me through all of that. Are people born with allergies and they get better? Will they always have them? Where do you land on this?
Yeah, and we're still understanding the science behind it. So my answer is not going to be perfectly crisp. But what we tend to see is a peak of allergies in school age. So age 4 till 12. Then we see it again around age 17 to 35. Those are the two peaks of when people develop allergies. And then we do start to see allergies fade as people get older. As it relates to seasonal allergies, there are a few exceptions. Food allergies in adults, specifically shellfish allergy. We tend to see that in adults age 35 to any age. And we can get into the science or at least the theory behind that, as well as skin allergies and medication-related allergies. Now, for medication, it makes sense because you tend to not be on as many medications when you're younger. So it's more about what you're exposed to. And then skin allergies, again, our skin barrier tends to break down more. We tend to use more products on our skin. And our skin is actually our first immune system organ and the largest immune system organ. So it's very sensitive to products that get placed on it.
Why the food, though? Right away, I wonder, why would we develop food allergies later in life?
So shellfish allergy in particular, at least the going theory around this, well, one is little kids tend to not really eat like a ton of shellfish. And it's particularly fish and shellfish allergy that present later in life. So that's one, is you're not really eating that as regularly part of your diet.
When you're focused on the chicken nuggets, you're
not
having crab.
Nuggets and pasta, I can't even get into it. I feel like the worst mother, but that's a separate conversation. So the thinking is, at least we've seen observationally that the use of alcohol and antacids has risen significantly, and particularly antacids. And the thinking is that it changes the pH of your stomach and it impacts the way that you break down certain foods, and for whatever reason, particularly shellfish. And so suddenly you're breaking things down one way, the pH of your stomach changes over time, and now you are breaking down those proteins differently, and now they are looking foreign to your gut. So as antacids and alcohol affecting the pH of your stomach, now all of a sudden that stomach, which is responsible for breakdown of proteins, is breaking things down in a funky way. And your body's like, wait a minute, I don't recognize this. This is something foreign. And then that triggers the allergic response.
Talking about food, are there foods that actually can make allergies worse? And if so, what are they?
So there are foods that are high in histamine content. You remember, we were talking before, histamine is one of the main chemicals that gets released from your allergy cells and is responsible for itching, redness, swelling, and congestion. So there are foods that actually have high histamine content. And sometimes I will recommend to patients who are really suffering in the peak of allergy season to avoid certain foods that are high in histamine. It's on the margin, though. It's not as effective as medications, but it sometimes can take the edge off. Yeah, when I list these foods, you're going to be like, there's no way. Really? So I can never have a wine and cheese party, right? I can't eat all these things that are so delicious. So it's red wine, it's aged cheeses, it's processed meats like prosciutto, it's fermented foods, so things like sauerkraut or kimchi, which oftentimes people are taking for the probiotic benefit and don't realize that they actually are high in histamine content. And then some interesting fruits, strawberries, pineapple, which oftentimes people will feel where they eat pineapple and they eat too much of it and all of a sudden their mouth feels itchy. It's histamine. And even avocados. So it's not, when I say this, people say, hey, but I thought avocados were good for me and I thought I should be eating berries. And the answer is yes, you should. But when pollen counts are super high and your allergies are completely out of control, you may want to consider a holiday from those specific foods because they do tend to be higher in histamine content.
I think it's one of those things that people have to just see where they land, right? So it could be the avocado is great for most of the year, but as we come into summer allergy season, they're feeling the effects more. And so what I tell people oftentimes is that there really is no one diet that's perfect for everyone. To a certain extent, you have to be aware that some of these foods are high in histamine and may make your allergies worse. But to another extent, you have to kind of know what works for you and what doesn't. Now, you mentioned pineapple, and I'm going to go a little bit off the rails here and let you know my son just had his wisdom teeth removed. And as like all kids who are in their late teens are doing, and I'm going to deep dive that at some point because it just seems like everyone needs to have their wisdom teeth out. And I do not remember that as a kid. But what's going around is that they should drink pineapple before they have the procedure because somehow that's going to decrease swelling. Are you aware in any way, shape, or form that pineapple is an anti-inflammatory and can decrease it? Or am I taking you into a really crazy territory?
This is crazy territory for me, but who knows? There are other foods that are anti-inflammatory.
What are the ones that I can come back and say, guys, you should be thinking about these foods?
No, tell them to eat some raw onion. See how they feel about that. But a raw onion has tons of anti-inflammatory and antimicrobial properties. It's also high in quercetin, which is something that helps to prevent inflammation and allergy type symptoms. So I guess, on the margin, maybe they're thinking, well, pineapple is more palatable and it's sweet and it's tasty, but there are, ginger, garlic, raw onion, all of those have anti-inflammatory benefits. So tell him to rub some garlic or raw onion on his gums and see how that goes over.
Yeah, I'm sure he'll love that. It's one of those things that, and you'll see this a lot. I'll be doing a lot of myth busting where things get popular and it gets passed on, but there's not really anything necessarily behind it. I mean, he's also taking ibuprofen. He's using a lot of ice. All of these things contribute to decrease inflammation, obviously, and decrease swelling. But of course, it's the pineapple that gets sort of the top billing.
There's also a lot of other theories about pineapple juice that we're not going to get into on this podcast, but people can research the other quote benefits of pineapple juice. All
right, so we talked about foods that are high in histamine and subsequently can really trigger your allergies. Is the opposite true? Are there foods that will actually quiet the immune system and help to a certain extent with the symptoms?
Look, I love the concept of food as medicine, right? Because we didn't have pharmaceutical drugs hundreds of years ago, and people didn't have allergies either. Blueberries, raw onion, kale, spinach, those are foods that are all high in quercetin. Turmeric is, I like to tell my patients to do a turmeric latte. It has anti-inflammatory properties as well. There's a lot of talk about raw honey, and we can get into some of the theoretical science behind raw honey, but at the end of the day, it does help soothe the back of your throat, and it does have some antibacterial properties. So it's on the margin good for you. It is not going to cure you of your allergies. That's another myth that we can get into, but it does have at least a symptomatic benefit. So foods that are high in quercetin that I just mentioned, garlic also has anti-inflammatory properties. And the last one I'll mention is fresh ginger, both from eating it as well as inhaling it. So sometimes I will say to my patients, take a pot of water, bring it to a boil, add some fresh ginger and breathe it in. And that actually has a nice anti-inflammatory effect on the nasal passages as well as the lungs. So that's a nice sort of homeopathic option for people that want to be medication free.
I know that a lot of people, as soon as they start to think that they are having symptoms that might be consistent with allergy, the first go-to move is the internet. So do you have any advice as to how people should navigate through the internet? And then if you think you have an allergy, what's the right course?
Well, you can follow me on the internet because I make sure that I give accurate health information, but misinformation is a real thing. There are resources like the American College of Allergy, Asthma and Immunology and the American Academy of Allergy, Asthma and Immunology. And what I like about those resources is they do crowdsource patient questions, so real live questions. And then they have a board certified allergist respond and also research all of the literature. It's called the Ask the Allergist. So you want to go to reputable sources like that. My go-to is typically a national organization to find that information. And then there are health influencers. You want to make sure, though, that they aren't just sensationalizing things and fear-mongering. So you want to make sure that they're board certified in their specialty. You want to Google them outside of the platform and see if they've published any papers, if they're on faculty at an academic institution, things like that add to their reputability and credibility.
You know, I ended up doing a piece on this with our mutual friend, Geeta Nayar, and we were talking about medical misinformation, and a lot of her advice was similar to yours, which is go to a reputable site. And then the other thing too is like, just stop for a second and think about whether or not this makes sense to you even, because oftentimes there are some really crazy claims that are being made. And then the next piece would be like, are there other people that are saying the same thing? It's a way of triangulating on it. And then I think you're right. Like when you go to credible sources and you know who's sharing that information, then you get a better sense for it. So seasonal allergies, what's your take here? Let's say someone says, look, I'm having a bunch of these symptoms, and you're like me 10 years ago when I didn't really know what was going on. What do you recommend in terms of getting the right diagnosis, which is so important?
The biggest thing is understanding when you're experiencing the symptoms. Is it when you go outside? Is it first thing in the morning when you wake up? Is it when you go to somebody's house and they have a cat? So some things tend to be really obvious, other things not so obvious. So really understanding your environment and even writing that down to understand where there might be patterns. Also, obviously, the time of year. So we are now coming out of tree pollen season. So people think, oh, allergies are over. But now grass pollen season starts. So if you're somebody who is on the golf course playing golf and you're like, oh, anytime I'm playing golf, I have allergies. Well, it's probably you're allergic to grass pollen and your season is about to start. Once you have that history, that's when the testing can confirm a diagnosis. It's actually not the other way around. It's not, let me just go get a test and figure out what I am allergic to. It is get a history and then let us understand what we should test you to, because otherwise you can have a whole bunch of what we call false positive results. And there are actually a lot of tests that are available online right now where you can get tested to, let's say, 100 foods or 100 different things in the environment, and you may have a positive test. And all that's going to do is cause unnecessary anxiety for you because it's not relevant. So you really need to interpret the tests in the context of a clinical history, which is what an allergist can do. Now, I'll warn you, though, when you see doctors, they will sometimes put 50, 60, 100 tests on your arm, and you walk out, and I always hear this from patients, I'm allergic to everything. That's really not useful. So really, you actually want to say, why are you testing me to this? Let me, and you can actually guide that conversation, especially if it's coming out of your pocket. Each test costs $5 or $6. So, if you have a high deductible, you really want to know what people are putting on your skin, why they're testing you to these things. Are these pollens that you're testing me to even relevant to my region? If I'm from New York, why am I getting tested to a bunch of things in California that I'm never exposed to? So all that's really important to be that informed consumer. So it's taking that detailed history and detective work and then doing confirmatory testing to make that diagnosis.
I think it's really helpful, specifically because more and more people have high deductible insurances, and we're so used to just letting the doctor decide. And quite honestly, folks, frequently doctors will just check a bunch of boxes. And to Tania's point, they might test for 100 different things that are all perfectly impossible or even not relevant, right? So ask the question, right? And make sure that it's lining up. So to your point, Tania, if it's sort of, we call it hay fever or hay season. The truth is, I think it's ragweed, right? And that's largely pollens that come from trees. And then you're right, like later in the summer, it's grasses. But you probably from history know what's causing it. I think people ought to be very specific, and it's okay to have this conversation with your doctor. It's really, really important that you do. Okay, so your advice is, do this with a partner, whether you're a primary care doctor or even an allergist. And then once you're diagnosed, what's the course of action? Maybe starting with OTCs, and then where do we go from there?
The first line of treatment is avoidance. And so that's why working with a trusted partner to understand what you're allergic to and then what your triggers are. So one of my passions is telehealth. And the reason why I love telehealth is because I could actually see into somebody's home. So if I were doing a telehealth visit with myself, I'd say, oh, well, what kind of plant is that you have in your office? And do you have symptoms when you're in your office? And maybe it's the plant that's triggering those symptoms and you need to throw that away. I would never know that if a patient was plucked out of their environment and put in mine. So I love being able to actually do virtual in-home visits to sort of do these walkthroughs and understand what could potentially be triggering a patient's symptoms. First line of treatment is avoidance. And I love that because it's a non-medication way to manage, right? Then the second line of treatment would be considering over-the-counter medications. And every time I walk down the over-the-counter allergy aisle, I get a headache because it is so incredibly confusing. It's a $12 billion industry. So many things are misleading and mislabeled. And so I would like to break down what the first line OTC treatments are, when to take them, which ones should you take every day, which ones should you not take regularly because they can trigger worse symptoms. So I'm happy to get into that.
Yeah, let's get into that. Let's say, look, I'm going to try to treat with over-the-counter medications. Give us some advice about what that should look like.
Antihistamines are not the first line treatment for allergies. Nasal corticosteroids are.
Okay.
Nasal corticosteroid sprays. These are your Flonas's, your Nasonex, your Nasacort, your Rhinocorts, right? Those work to decrease inflammation in the nasal passages. Think about your nasal passages being like a faucet right now with all this mucus and everything being developed, and it turns off the faucet. So what it helps with are not just the nasal symptoms, but the postnasal drainage down in the back of your throat and eye symptoms, as well as sinus symptoms. However, steroids take time to build up in your system. And nasal corticosteroids need to be taken consistently for at least 5 to 7 days before you're going to see a benefit. So oftentimes people say, oh, I tried the nasal spray and it doesn't work. The other thing is people get concerned when they hear the word steroids. Oh my gosh, I don't want to take steroids. These are locally acting. They're not getting absorbed systemically. So they're not getting absorbed into your body. The most common side effects are things like crusting or bleeding. And that's often because of the improper use where you're pointing it towards the middle of your nose and your septum, and then the medicine just sits there. So you always want to point it up and then out. And I do have some videos on my channel on how to actually use a nasal spray properly. So use it for 5 to 7 days. And what it does is it calms your immune system down and prevents the allergic reaction from occurring. So we oftentimes will recommend to our patients, if you know June is your pollen season, then like May 15th, you should actually start on the nasal spray and get it in your system and then be allergy free for the rest of the season. And then you can stop it when your allergy season is over. So that's the first line of treatment.
That's really, really important. And I don't think many people know this. Oftentimes we wait for the symptoms to start, but we're already behind, right? The horse is out of the barn at that point. So what you're saying is, hey, if you know that you're going to have seasonal allergies, get going on these medications, on these nasal sprays before you develop the symptoms, because if you can prevent the symptoms, you'll end up having better outcome.
That's right. I also, another like non-medication way to manage this is doing sinus rinses. Because if you think about it, you're walking around outside and you're breathing in pollen from your nasal passages. You should be washing that out regularly. Just like if you saw a bunch of pollen or dirt or whatever on your hands, we wash our hands frequently. We should be washing out our nasal passages frequently. We don't often think to do that. So have a nasal saline spray or use a neti-pot or a sinus rinse and use that throughout the course of the day to flush out your nasal passages. Otherwise, the pollen's going to sit there. And when the pollen that you're allergic to is sitting there, what's going to happen? Well, you're going to have an allergic reaction to it. And then another really simple thing is when you're outside and then you come inside, rinse off. So you're not tracking all of the pollen into your home.
That's really helpful. Okay, so you're going to be rinsing, you're going to be taking nasal sprays before you develop symptoms. What next?
Then let's talk about over-the-counter antihistamines. They're helpful as needed. So if your allergies are not that bad, you may want to keep an antihistamine in your purse just to take it when your symptoms start to flare up. And then they typically last for 24 hours. But not all antihistamines are created equally. What are antihistamines? Benadryl, Claritin, Zyrtec, Allegra. Those are the most common ones. Benadryl is a first-generation antihistamine. Claritin, Allegra, Zyrtec, those are second-generation antihistamines. First-generation antihistamines are older. They're not as sophisticated, I like to say. And what they do is they can have systemic side effects and they cross into the blood-brain barrier, which is why people often get very drowsy from it. They become forgetful. You shouldn't operate machinery, as in you shouldn't be driving, taking Benadryl and then driving your car. The second generation antihistamines, typically either very little amount crosses to the blood-brain barrier or it doesn't at all. So these are the newer antihistamines that have fewer systemic side effects. Just to go back to Benadryl, chronic use of Benadryl, because we know people often use it for sleep. Number one, it doesn't help with quality sleep. You actually have fewer cycles of REM sleep. So over time, it actually can damage your sleep. Number one. And number two, studies have shown that it's associated with dementia, long-term use of Benadryl. So we really, at this point, say we're not fans of Benadryl. We really don't recommend it. There's lots of other options out there. So typically a Zyrtec, Allegra, or Claritin. Of the second generation antihistamines, Claritin is the oldest. So it does tend to have the most side effects, not as bad as the Benadryl. Zyrtec is a little newer, and then there's Allegra. Allegra typically doesn't cause any drowsiness, but it takes a little bit longer to kick in. It takes about an hour. Zyrtec works a little bit more quickly, but about 10% of the population can get a little drowsy. So again, all based on your preference and then having an understanding and working with your doctor to say, hey, this is the regimen that will work best for you. And before I get off this topic, there are also nasal antihistamine sprays and antihistamine eye drops. And I tend to prefer things that work locally versus systemically.
Yeah, that's really helpful. Now, I'm going to take you in another space. You mentioned it earlier, which is there are some medications that people can take, and they actually make you worse in the long run. I think you're talking about the paradoxical effect of something like Afrine. Am I going in the right direction here?
Yep, Afrine and Visine. So Afrine is really good at constricting the blood vessels in your nasal passages and sort of turning off that mucus faucet. However, it's so good at it that your body gets used to it. And then when you stop using it, you get this fancy thing called rhinitis medicamentosa, which is a fancy word of saying, oh my gosh, my blood vessels are swollen again because I got essentially addicted to this spray. So you really want to limit the usage for 3 to 5 days. That's why I typically will recommend it to people who just have a cold. But if you have allergies and you're relying on Afrine and you're using that every single day, as soon as you stop using the Afrine, guess what? The nasal congestion is going to come back with a vengeance. So much so that we often have to put people on oral steroids to taper them off of the nasal spray. So it's just not worth it.
I remember that too in the emergency department. Frequently, people would want the immediate effect of an Afrine, not realizing that it actually can do a lot more damage in the long run. Okay, so let's say you've tried all of that and it's not working. Now it's time clearly to be seen by an allergist. What are the next steps? What are the next levels for treating people who have severe allergies?
Allergen immunotherapy. So what is allergen immunotherapy? It's commonly known as allergy shots or allergy drops, but this is where an allergist gives you small amounts of what you're allergic to teach your body that it's not foreign, to teach your body to no longer be allergic to it. So in a lot of senses, it's a medication-free way. We're saying, hey, we're going to desensitize your body to this. You thought it was foreign, but we're going to show you slowly but surely that this is just something normally occurring in the environment. And we're going to give you small amounts, and we're going to increase that dose over time so that you can now tolerate and teach your immune system to no longer be allergic. Now, there's a commitment. For allergy shots, you actually have to do it once a week for about 6 months, and then after that, monthly. For allergy drops, though, you do 2 drops under the tongue from home. You don't have to go to a doctor's office, and you continue on the therapy. But both for shots and drops, you need to be on it for 3 to 5 years. Benefit, though, is 80% of people don't have the allergy anymore. So it can cure people of their allergies. It's one of the few things where we could actually cure somebody in medicine versus just treating symptoms. And even if you don't experience a full cure, majority of patients will say they have significant improvement in their symptom scores, and they really don't need to take anything other than an occasional antihistamine.
Okay, I want to tease apart the shots versus the drops. I like how you phrased that. So the shots, you need to go to the doctor's office, obviously, and then I think they keep you there 20 to 30 minutes afterwards. So it's a commitment. Whereas the drops, I think you go the first time, they make sure that you're okay with the drops under your tongue. And if so, you can do them from home. Now, what about when it's a seasonal allergy versus just an allergy? So I'm thinking now, I'm allergic to pollen versus I'm allergic to peanut. Do you, for the seasonal allergies, have to be on that year round, or is that only during the season? And then what about for the things that are kind of year round?
I first want to separate environmental allergy treatment from food allergy treatment. And we need to get into the food allergy treatment. But for environmental allergy treatment, you're keeping me honest. There's 3 things. There's shots, there's drops, and there's tablets under the tongue that are actually like FDA approved medications. For the tablets, you take them for your allergy season. So if it's grass pollen season, you're taking it for 3 months. It's single allergen, meaning that if you're also allergic to dust and cats and dogs, they don't have pills for all of those things. And so you're taking it for, let's say, grass pollen. And then the first dose is given in the office, and then you can continue to take it from home. Allergy drops, which are typically formulated in a doctor's office or at an outside pharmacy, a lot of companies, online companies, will ship them directly to your house, and you can start it from home, and it's just 2 or 3 or 4 drops every day. That space is not as standardized. It's certainly not as standardized as the FDA approved tablets, which has the same amount of allergen in every pill. So the issue, both with shots and drops, is it's based off of whatever allergist dosing schedule they have and what they believe to be therapeutic amounts of allergen. So you really want to make sure you do your research on the doctor that's giving you these drops or shots. A lot of times patients will come to me and say, I was on shots for 5 years, it didn't do anything. And then my question is, well, how much of the allergenic protein was actually increased over time? And were you treated for 10 or 15 different allergens when maybe there were only 2 allergens that were the problem allergens for you, but someone just put whatever you tested positive to in your mixture? Then it ends up diluting itself out. So you want to really get smart on immunotherapy. When done properly, you can be cured, but not all doctors are standardized in the way in which they create these formulations in the back of their office and how their dosing protocols and regimens.
First of all, that's fascinating. I didn't know that myself. And so I'm learning throughout this entire segment. I'm loving it. But how can people do that? Like, that's not easy because most people don't have the background to question their physician. So that feels wonky to me. So what's your advice to people? they've done the over-the-counter route. They've now gone to see a physician. What is the best way to be sure that they're on the right track?
That's a great question. It starts with understanding your testing and what you were tested to and matching that to how relevant is this? Because again, it's like a coin toss. You can have a false positive test. It means nothing. You need to say, okay, I tested positive for tree pollen. Are these the trees that are in my region? Yes. Okay. Am I allergic from March to May? Yes. Okay. I should be treated for tree pollen. It's super easy if you know you're allergic to cats. Then anytime you're around your cat, you sneeze and then you test positive. Okay. So that should be included. So it goes to understanding your testing, making sure that you got appropriate testing, making sure your testing is relevant. And then from there, it is really getting smart and almost needing to sort of read the protocols and the research to understand, okay, doc, if I'm going to go on these shots and I'm going to make this commitment, which is like, I'm making a 3-year commitment and you're telling me I go to your office once a month. Like, I better do my research around this, How are we going to increase the dose? By what increments are those doses going to be increased? And what's our target? And how are we going to know if I'm getting better or improving? Or am I just going to keep on this to oblivion? So schedule 3-month check-ins with your doctor to say, okay, I actually want to review my shot record. Did we have to repeat the same dose a few times because I didn't tolerate it as well? Should we be adjusting or adding different allergens? Should we be repeating my testing, which I would recommend doing every 6 months to 12 months? And I will tell you, most doctors don't do that. So you really have to be your own best advocate to, you're paying for this thing and you're giving the commitment of time. So it better be, optimized.
You just gave a ton of really good information, but it's a lot. And people will blank when they go to see their doctor. So folks, it's really important that you take the time to write these questions down. In preparation for that visit with the allergist, it's really important that you've written these questions down so that you can put it together with your doctor. Now, really good doctors are your partners. Tania used that word earlier, and they want to work with you to make sure that you're getting the right treatment. And it starts with you asking the right question. If you're listening to this segment right now, you're interested, but make sure you're prepared. And that means that you are taking notes during the interview or the appointment with your doctor. Oftentimes now people have a smartphone and you can actually record the information, and that's fine. Most doctors are good with that. So later you can listen back to it, but you've got to be ready with the questions too. And Tania's given a bunch of them here. So very helpful. Is there such thing as a hypoallergenic pet? We'll get into it after the break. C2 Sense is doing important work with its Halo platform, applying technological advances in chemistry, machine vision, and material science to provide both patients and providers with laboratory-level accuracy at low cost when they need it. The pandemic reinforced the importance of being able to test in the privacy of your own home. C2 Sense's goal is to use their patented technology to ensure the same quality of testing you would find in your doctor's office in the comfort of your own home. So if you're suffering from upper respiratory symptoms like cough, sore throat, nasal congestion, or a headache, keep your eyes out for C2 Sense as they're developing tests targeting upper respiratory conditions such as COVID and flu. If you want to learn more, see what they're up to at haloreader.com. Tania, let's move indoors now. What are the common allergies that people should know about indoors?
Pretty simple list: pets, dust mites, mold, cockroaches, and mice.
Okay, I won't start with mice and cockroaches, but pets are huge. So what do we need to know about pets?
Let me just say, because we like to do myth busting, there is no such thing as a hypoallergenic cat or dog. And it has nothing to do with whether or not the dog sheds, because you might not be allergic to the hair. You might be allergic to their urine. You might be allergic to their saliva. You might be allergic to their skin cells. These pets have a number of different allergenic proteins that people can react to. So you may actually be allergic to one dog and then not another dog, depending on which allergenic protein that dog contains. But there's not a specific breed that would be considered hypoallergenic.
Is there any testing? Like if, let's say a young family with little kids wants to introduce a dog, a cat, can you do any testing to figure that out? Or is it sort of trial by error?
You put them in a room with a dog or cat and see if they sneeze. It's as simple as that. And then do a confirmatory test. And you always want to do that history first, as opposed to you take a kid, oh, I'm thinking about getting a dog. They've never even seen a dog before. And let's now do an allergy test. Oh, looks like they're allergic to dog. That's not how it works. You always want to do the history first and then get the test as a confirmation.
Got it. I think I heard something about shots for pets that they might take so that they become less allergenic. True or not true?
Yeah, I would say the science isn't there yet, number one. And number two, that injection or that shot to the pet might have them have one of the allergenic proteins missing. But like I said, you can be allergic to a number of different allergenic proteins. There's in dogs, it's something called CAN-F1, CAN-F2, CAN-F3, CAN-F4, 10, 20. And then similarly with cats. So like it might partially protect against one of the allergenic proteins, but not all of them.
Got it. So it's old school, which seems like just very basic advice, which is expose your kids to the animal, get a sense for whether or not there seems to be some allergy there. If so, then follow it up with testing.
And let me tell you one other thing about exposing your children to this. Exposing children to pets early on, within the first 12 months of life, decreases their chances of having a pet allergy in the future. So you actually want to have early exposure to pets as a preventive measure so that your kid doesn't have allergies down the line.
Oh, that's really interesting. Like I've never heard that before. I can tell you that when my son was born, we had 2 Goldens. We kind of always have 2 dogs. And I wonder if that contributed to my kids not being allergic, which is that from day one, they've always been around dogs.
Yep.
Very helpful.
Kids with multiple siblings, kids who grow up in rural areas, and kids who roll around in dirt and are around animals are less likely to have allergies because their immune systems are getting the right inputs to develop properly. If you want to keep your kid in a bubble, you want to chase them around with hand sanitizer, you're going to end up having a kid who has allergies down the line.
If I can find it, I'm going to put up a picture of my son when he's little and he's at the beach and he's eating sand. Okay.
And you did it right.
It's confirmatory now. And we just never played that game. Like we never tried to prevent our kids from getting dirty, from eating sand. We just kind of let them do their thing. And what you're saying is that's the right thing to do. Their immune system is going to get exposed. And then it's going to become more robust, which makes me think about something that I've heard and I'd like your opinion on, which is that because of the pandemic, oftentimes people say they're not as exposed to as many other viruses and infections. Has that in any way decreased immunity, or is that just all a wives' tale?
I don't think that the pandemic was long enough to really impact and skew. We're talking about like a generation of parents who literally chased their kids around with everything antibacterial, antivirus, running around spraying Lysol and hand sanitizers and all this. And this idea that you had to keep your kids clean. And what you did was you got rid of all the good bacteria too. And now we learn that good bacteria is important. It's important for your microbiome. It's important for your skin biome. So now we're moving the other way to say, like, let them bathe in the forest floor, for God's sakes, and let them have all of those exposures early on so that their immune system develops properly. Otherwise, it's going to start thinking that normal things are foreign. And it's not just the case for environmental, it's also for foods. And we learned this the hard way with peanut.
For a long time, and I think it was the American Academy of Pediatrics, suggested that we don't expose kids to certain foods immediately. And then when we do that you would do it one at a time, which seems to be exactly the wrong advice. And now I think we've gone in a very different direction.
And, we have to hand it to the American Academy of Pediatrics and others to say, we didn't know. And we made this recommendation based off of what we knew at the time. And now we've learned more and more about the immune system and science has evolved. And now we're going to change our position. And so what we've learned is that early exposure, again, allows your immune system to discern what is foreign and what is not foreign. What happened with peanut is there was a recommendation to delay peanut introduction until after the age of 2. But guess what? Peanut was prevalent in the environment. And so babies were likely getting sensitized because you need to have an initial exposure to something before you develop an allergy, probably getting sensitized through their skin, which is also why we like to say, do not put food products on your skin. Wheat oil, almond oil, all these sorts of things. You want to have them ingested. You don't want to be having the initial exposure be through your skin. When it is, the body says, this is something foreign, just like a virus or a bacteria. So then when you do eat it, it's like, oh no, that was that weird thing on my skin. I'm going to develop an allergic reaction to it. And then we actually saw proof of concepts because in other countries, people use peanut as part of their teething ring. It's something called bamba. The incidence of peanut allergy in those countries is 0.2%. The incidence of peanut allergy in this country is 10%. So it's almost a proof of concept that exposing the immune system to foods and environmental things early on and not withholding those things from the body is what helps the immune system develop properly and helps you build tolerance to normal things occurring in the environment.
Yeah, I think this is a really important point, and I'm glad we had a chance to talk about it. And I like too how you said, like, look, we're always evolving in science. I think, and correct me here if I'm wrong, it was the LEAP trial that looked then at early introduction of food, and we got some data behind it, and then we changed the opinion, which is just how we get better. Tania, what are some of the signs and symptoms that your kid may be allergic to foods?
90% of the time, you're going to have skin symptoms. So things like hives or swelling. I should say, though, if you'll know if your kid's allergic, they eat something, their face blows up, or they have a really bad rash. What I want to avoid people doing is saying, I'm curious if my kid's allergic to this. So they go to the pediatrician and the pediatrician just orders a food panel test. You may end up with a positive test. There's nothing to do with that. There's no corresponding history. And what you could end up doing is if you avoid those foods, you may cause your kid to develop an allergy in the future because you're removing something that, again, should be normally occurring in their diet. So it's really important to understand the signs and symptoms, but not just go off and order a food panel test because the results are insignificant without that history.
I really appreciate you calling that out. And I want to thank you for being a part of this. It's been a wonderful conversation. But before I let you leave here, there's one last thing, which is sharing beauty. And as all of you know, what I do as we wrap up the show is I ask our guest to share some beauty. Tania, it's something that I've done in my family for a while. We'll call out beauty, and I'd like for you to do the same. So what do you have for us?
I love that you asked me this question. So I just want to share one of my favorite songs, and it's called Adore You by Harry Styles. And I like this song because it speaks to unconditional love. As a doctor, I tend to have always been a perfectionist and always wanting to perform and thinking that if I succeed, then I am worthy. And this song is just like, you know what? You don't have to do anything. And let me just adore you. And let me just love you and for who you are, right? The good, the bad, the ugly. And that just really resonates with me. So whenever I'm feeling down or whenever I'm feeling sad, I just let Harry tell me that all he wants to do is adore me. And then it just puts me in a better mood.
I love it. I mean, that's exactly what sharing of beauty is about. So thank you so much. And thank you for joining me today. I really enjoyed this conversation. You educated me throughout the entirety of this conversation. So thank you. I look forward to having you back where we can go deeper into other topics.
I love it. Thank you so much for having me.
Folks, what did you think of this episode? I'd love to turn this into a dialogue. Please send me comments, any questions you have. If there are topics that you want me to cover, go ahead and leave them in the comment section. I'll do my best to answer all of them. Today's show was produced by me and Batsheva Gez. See you next time. This show's content represents my personal opinions. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not create a physician-patient relationship with me. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or your general health.